partly learning objectives for lecture have to do with the bony pelvis. The entire bony pelvis is made up of two os coxa. This one bone is called an os coxa, a pelvic bone. Sometimes it's called the innominate bone. So two of those plus a sacrum and a coccyx make the full bony pelvic cavity. Okay? We can distinguish the superior pelvic inlet, or the pelvic inlet, I should say, and the pelvic outlet. All right? And so the pelvic cavity, the true pelvic cavity, is the space between inlet and outlet. Okay? Almost completely surrounded by bony tissue. We've talked about how that space doesn't really expand very well, so an organ like a pregnant uterus has got to come out of that bony space into the abdominal cavity, where it can then stretch out and get big, right? We can refer to the false pelvis as the space cranial to the pelvic inlet, but still kind of near the ilium, which is the superior and broad part of the bony os coxa. So this is your ilium. And so that urinary bladder that starts in the pelvic cavity when it's empty will rise up a little bit into the false pelvis. It's still associated with the pelvic bones, but it's outside of that complete bony enclosure. Okay, so true pelvis here, false pelvis about here. All right? Okay, so this single bone is called an os coxa, and it's formed from three bones that fuse together mostly prenatally and then partly postnatally. The three bones are the ilium, which is this broad superior part, which you put your hands on your hips. That's your iliac crest that you're touching. Then you have the pubis, which is this anterior part. Remember, the two pubic bones articulate together at a symphysis. That means there's fibrocartilage there. That's an amphiarthrosis. And then you have your ischium, which is the posterior and kind of inferior part. This big bony bump is the ischial tuberosity. We think of that as the butt bone, because when you sit, the muscle slides, and that is the bony surface that you might sort of feel on a hard chair if you're sitting for a really long time. That's what bears the weight of your body when you sit. So ilium, ischium, pubis. Okay? You have to know the articulations of the bone. So at one pubis is going to be the other pubis at the pubic symphysis. We talked about that, fibrocartilage, amphiarthrosis. Then you have on your ilium what's called the auricular surface, this little kind of curved portion. That's for the sacrum. It's called the sacroiliac joint. It is a plain synovial joint, so it's a diarthrosis. And then you have your hip joint. This is the acetabulum of the os coxa, and the acetabulum is one of the places where the three bones fuse together. So all three bones contribute to the acetabulum, ilium, ischium, and pubis. And that, of course, articulates with the head of the femur. And we know that's synovial, ball and socket, diarthrosis. So those are the three articulations that you have to know. And then you have to know how to side this, right or left. Okay? So to do that, your ilium has to be superior. Your acetabulum has to face what direction? Laterally. And then to sort of properly orient it, your auricular surface, what did I say that articulates with? Sacrum. So that has to be both medial, but notice the sacrum is also the dorsal wall, so you want to tip that articulation dorsally. That creates your nice curve and your nice direction of the pubis, which has to go right to the midline. So the pubic symphysis is right at the midline. So when you hold it like this, you don't have your pubis in the right place. It's got to angle towards the midline. Okay? That creates an anterior side and a posterior side to your ilia, which is important because this feature here is the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. And if you just hold it like this, you don't have anterior or posterior orientation. When you hold it properly with the pubis angling towards the midline, now you've got clear anterior and clear posterior spines. The other way to remember it is, you know your sacrum articulates here, you know your sacrum is posterior, so the spines near that articular surface are the posterior spines. Okay? So this is a left. Okay? All right. You're also asked to be able to determine if a human pelvis is male or female. So this is sexual dimorphism, right? right? And so the sexual dimorphism of the human pelvis is all about delivering a baby, all right? Sexual dimorphism always has a biological purpose. In this case, it's about delivering a baby. So I'm going to go over the whole list of traits that are in your PowerPoint notes. Some of them you can actually observe on these bones in lab, and some of them you can't, but you still have to know the ones you can't see for lecture. So one of the ones that you can't assess here is that female bones are lighter. Okay, you're not going to get that out of these two models. Also, we talked about the coccyx before, the dimorphism of the coccyx. So in the female, the coccyx is straighter. It kind of hangs back more. In the male, the coccyx curves inferiorly more. And what that does in the male is obstruct the pelvic outlet. Okay, that's where the baby has to come out. When the coccyx is straighter, it creates a larger pelvic outlet, more room for the baby. That's really what most of these modifications, most of this dimorphism is for. So you can see we can fit the baby head through the female. But if we try to get the head through the male, we get a coccyx to the face, right? Not enough room. That's what the dimorphism is doing. So curved coccyx in the male, straight coccyx in the female. Also, and you really can't assess it on these, the female coccyx is actually more mobile. So it has more sort of give to it. There are ligaments that kind of pull it back even more during delivery. Sadly, on these models, the male coccyx is wiggly. Okay, so that's not an accurate depiction of coccyx mobility, but you do want to know that, right? Okay, the biggest one really is what we call the pubic angle or the pubic arch. So when your right and left pubic bones articulate at the symphysis, an angle is formed here. It's going to be a larger angle in a female than in a male. So look at the male, it's an acute angle, right? And look at the female, it's much broader. And what that does is opens up the space here. It makes it a bigger space in the outlet again. Right? So shorter distance between these two ischium here, bigger distance here, helping to enlarge the size of the pelvic outlet. All right, and then the ischial tuberosities, so that those butt bones I was talking about, are going to be more everted on a female. So they kind of turn outward a little bit, again, increasing the pelvic outlet. That you don't necessarily see so much, but they are everted on a female, okay? And I think those are the basic features that you want to be familiar with. Oh, one more. On the female, the pelvic cavity is broader, so it's wider across, but shallow. So it's not as deep in a female as in a male. And if we think about that for a minute, we know that the uterus is going to come way up into the abdominal cavity and a giant baby is going to develop. But then that baby has to get back through this bony space to get out of the body, to be delivered. And so if you had a deeper bony space, there's really kind of just more treachery in trying to pass that baby's body through that bony space where it could potentially get stuck. So a more shallow bony cavity is just sort of, I think of it as a shorter danger zone in passing the baby through to get into the vagina and then out of the body. Okay, so a shallow cavity in a female, but a broader cavity in a female.
Is that an adult female pelvis we're looking at right now?
Yeah. I mean, obviously there's variation, but and then the other thing is that the notes in the book will talk about the shape of the inlet. You know, I don't like shapy things, but the male is supposed to be more heart-shaped than the female. You can see that. You can go with it. I prefer the arch, the curvature of the coccyx, the ischial tuberosities. And then another way to help you assess the coccyx curvature is to take a lateral view. So if you take a lateral view, you can see there's not much distance between the coccyx and the ischial tuberosities in a male. But if you look at it in a female, there's definitely more space here. Okay. So my advice to you, a couple things I want to tell you about the lab practical with regard to this question. I'm definitely going to ask you to sex the pelvis, determine if it's male or female. It will not be either one of these two. I have many others, okay? And you're not going to get two of them. You're only going to get one. So you have to be able to assess an individual pelvis for these traits, not comparing, right? This one's more whatever than that. You have to be able to look at one and say, oh yeah, that's a broad angle, or that's a straight coccyx. I also won't give you the fetal head to pass through, but you can certainly use your fist as a simulation to try to help you determine if there's enough space for a baby head to get through. Okay, and then the last thing I would suggest is that you go around and check out all the different pelvises in the room and see if you can assess them. Even the guys standing on poles, you can try to assess their traits and figure out if it's a male or a female. When you do it, don't just look at one thing. Don't just look at the angle and determine it. Look at the angle and the coccyx. Try to assess a couple of traits, because sometimes one trait isn't crystal clear. You kind of feel like, ooh, I think it's this, but it's kind of ambiguous. But then when you look to a second piece of evidence, it'll sway you one direction or the other. So definitely assess more than one trait when you're trying to figure it out. Okay, so that was kind of what we skipped over in lecture, but this is really, the hands-on place to best learn it anymore.